Hi there, I'm Curtis Holt, transplant pharmacist and clinical professor for the DeMont UCLA Transplant Center. Today, we're going to discuss some very important items for you following your liver transplant. We're going to discuss medicines following your transplant. We're going to talk about those that are lifelong, life-saving, and the ones you need to listen to us. These medicines include the immunosuppressants, some medicines that are supplements, and importantly, some medicines you can buy and purchase over the counter to help in your liver transplant life. Please listen to us throughout this presentation. We need your undivided attention so we don't miss anything. Thank you so much.
Medications at discharge. Discharge medications. With the exception of Kaiser patients, discharge medications will come from the Ronald Reagan UCLA Discharge Pharmacy. Copays. Every patient has a different medication insurance plan. We do not know the details of your plan. You can call the pharmacy or your insurance to determine your copay. The copay cost is usually approximately $50 to $1,500 per month. Kaiser Permanente patients receive 3 months of medication at discharge. If you have Kaiser insurance, your pharmacy is the Kaiser Sunset Pharmacy. Their telephone number is 323-783-9069. Most pharmacies have a mail order delivery service. Medications at discharge continued. Medications will be delivered to the hospital before you leave. Your pharmacy will deliver all your medications to the hospital. A pharmacist will teach you and your caregiver about your medications before you leave the hospital. After the class, take these medications home. These are for use once you go home. Do not give these medicines to any nursing homes or rehabilitation facilities. Take these medications home. Refills once you return to home. Call the pharmacy. The pharmacy number is on each bottle to order your refills. You should contact your pharmacy 7 to 14 days before you will run out of your medications. If you call a few days prior to running out of your medications, you can miss doses of some very important medications. We will teach you again before you go home. Before you go home, we will meet with you and your caregivers in your hospital room to review all of your medications and follow-up appointments. A detailed medication list will be provided to you and your caregiver at this time.
Now we're going to talk about common medications after the transplant. We're going to begin with the most important medicines known as immunosuppressants. For the rest of your life, you will take 1 to 4 immunosuppressants to prevent rejection of your liver. Without these medications, you will reject and lose your liver. The immunosuppressants work by weakening your immune system by interfering with how your immune cells work. These medicines prevent your immune cells from attacking and destroying your liver. This causes an increased chance for infection because your immune cells will not be as likely to be able to attack bacteria, viruses, or fungus within your body. These medicines will be given lifelong after your transplant. There are some considerations about the immunosuppressants, and specifically we want to make sure that you know that only your UCLA liver doctors can change your liver medications or doses. You should never stop or change the dose of any of the liver-related medications without asking your transplant physician or your transplant coordinator. The most important immunosuppressant medication you'll take is known as PROGRAF. It has a second name called TACROLIMUS. We monitor the level of PROGRAF at each lab draw, and we will always notify you if you need to make any changes in your doses. PROGRAF, also known as TACROLIMUS, comes in 0.5, 1 milligram, and 5 milligram capsules. It must be taken every day for life after transplant, 12 hours apart, usually at 8 a.m. and 8 p.m. PROGRAF also interacts with many substances, including grapefruit products, starfruit, and pomegranate. Therefore, you must avoid these products at all times. PROGRAF also has a number of side effects that are very manageable. These include effects on the nervous system, the kidneys, the stomach, and also the blood sugar. So we're going to start with the nervous system side effects. The most common one include tremors, headaches, numbness and tingling or pain in the extremities, including the arms, legs, hands, and feet. There sometimes can be numbness around the mouth. Food can taste differently. Folks can become confused or drowsy and sometimes have difficulty finding their words or have difficulty speaking. The most important side effect is perhaps seizures. Seizures can happen in around 1 in 200 people, and they're actually a medical emergency, and if you're experienced at home, you should call 911 immediately. Additional side effects from PROGRAF include itching, hair loss, and because it's an immunosuppressant, there will be a lifelong increased risk of infection. PROGRAF can also cause additional side effects on the kidneys, the stomach and intestines, and the blood sugar. PROGRAF can increase potassium in the bloodstream if the kidneys are unable to filter out enough potassium, and this can lead to an irregular heartbeat. PROGRAF can also cause the kidneys to cause fluid retention, high blood pressure, and an increase in magnesium loss through the urine. When PROGRAF affects the stomach and intestines, it can cause diarrhea, nausea, and a decreased appetite. When PROGRAF affects the blood sugar, it can increase in about 20% of patients who take the medicine, of which half will require insulin injections. If you're already diabetic, you may require more insulin while taking PROGRAF. If you're not diabetic but have other blood relatives who are, you may develop diabetes, also known as high blood sugar, while taking PROGRAF. The next medicine we'll discuss is Neoral and Gengraf, also known as cyclosporin modified. We monitor the level of this drug at each lab draw and will always notify you if you need to make any changes in your dosing. Cyclosporin modified, Neoral or Gengraf, comes in 100 milligrams and 25 milligram capsules. It must be taken twice a day, 12 hours apart, usually at 8 a.m. and 12 hours later at 8 p.m. Like PROGRAF, you must avoid all grapefruit products and possibly starfruit and pomegranate. Patients who take cyclosporin Neoral may experience similar side effects to PROGRAF, including nervous system side effects and the effects on the kidneys. Additional side effects from Neoral and Gengraf include enlargement or overgrowth of the gums, muscle and joint pain, increased hair growth, often on the face, arms, and legs, elevations in blood sugar, although not as common as seen with PROGRAF, an increased risk of infection, elevated cholesterol levels, oily skin, diarrhea, a runny nose, hot flashes, and sweating. Prednisone is another immunosuppressant medicine that we routinely administer following liver transplant. Prednisone is a steroid that reduces inflammation in your tissue and in your new liver. All liver transplant patients take prednisone with their other medications to prevent liver rejection. Prednisone can cause a breakdown of muscle and bone tissue, unlike the steroids that the athletes sometimes take to build muscle. Therefore, dosages are carefully monitored. You may eventually be taken off this medications, and drug levels for this medicine is not checked. Prednisone can cause a lack of sleep and should be taken in the morning to prevent you from having trouble sleeping at night. We also will prescribe an anti-ulcer medicine for you, since ulcers are a side effect of prednisone. Side effects with prednisone improve or disappear as the dose is reduced. Prednisone should never be stopped abruptly and needs to be slowly tapered or decreased over time. Prednisone may cause a number of side effects. Usually, side effects are more frequent when higher doses of prednisone are administered. Side effects include acne, insomnia, known as difficulty sleeping, facial puffiness, slow wound healing, an increased risk of infection, weak muscles and muscle loss, decreases in bone density and weak bones, also known as osteoporosis. Prednisone can cause high blood pressure. Prednisone can cause fluid and salt retention, leading to bloating and swelling. Prednisone can lead to mood swings, including irritability and emotional changes. It can increase blood sugar or cause diabetes. It can increase the appetite and cause weight gain. Prednisone can cause thinning of the skin and easy bruising. It can cause stomach ulcers or stomach irritation. It can cause vision changes or cataracts, usually with long-term use. Another type of immunosuppressant is called CELLCEPT, also known as mycophenolate, MOFETIL, and MYFORTIC, also known as mycophenolic acid. CELLCEPT, mycophenolate MOFETIL, comes in 250 mg and 500 mg capsules or a solution. MYFORTIC, known as mycophenolic acid, comes in 180 mg and 360 mg tablets. These medicines must be taken twice a day, 12 hours apart, usually at 8 a.m. and 8 p.m. No drug levels are monitored with these medicines. Taking CELLCEPT or MYFORTIC allows us to decrease your doses of other immunosuppressants while still preventing liver rejection. Sometimes this is done to try and help your kidney function work better. This medicine can cause your white blood cell counts to be low, and it can increase your risk for infection. CELLCEPT or MYFORTIC can cause a number of side effects. These include nausea, diarrhea, or poor appetite. Furthermore, CELLCEPT or MYFORTIC can cause a low white blood cell count, leading to an increased risk of infection. Other side effects include risk for certain types of cancers affecting lymph nodes, blood cells, and skin. Another immunosuppressant medicine that's used is a medicine called ZORTRESS, also known as EVEROLIMUS. We monitor the level of this drug at each lab draw and will always notify you if you need to make any changes in your dosing. Like PROGRAF and cyclosporin, you must avoid all grapefruit products and possibly starfruit and pomegranate. EVEROLIMUS comes in 0.25, 0.5, and 0.75 milligram and 1 milligram tablets. It must be taken twice a day, 12 hours apart, usually at 8 a.m. and 8 p.m. Patients who take EVEROLIMUS may experience a number of side effects, including high blood pressure, rash, acne, anemia, diarrhea, slow wound healing, and increases in their cholesterol and triglycerides, as well as a decrease in their platelet level. You must have your cholesterol levels checked on a regular basis. Another medicine similar to EVEROLIMUS is a medicine called Rapamune, also known as sirolimus. We monitor the level of this drug at each lab draw and will always notify you if you need to make any changes in your dosing. You must avoid grapefruit products, starfruit, and pomegranate. Rapamune comes in 0.5, 1 milligram, and 2 milligram tablets, or 1 milligram per cc elixir or liquid, and is taken at 8 a.m. People who take EVEROLIMUS may also experience a number of side effects, including high blood pressure, rash, acne, anemia, joint pain, diarrhea, low potassium in their bloodstream, low platelet counts, and an increase in cholesterol and triglyceride levels. It may also cause slow wound healing. You must have your cholesterol level checked on a regular basis. Now we'll discuss some general rules about taking your immunosuppressant or anti-rejection medications. These medicines must be absorbed to work. So, if immunosuppressants are absorbed in your stomach and intestine, any situation that impairs the absorption, such as persistent vomiting or diarrhea, can increase your risk for liver rejection. With respect to vomiting, if you vomit within 1 hour of taking the immunosuppressant medication, or you can see the pills and capsules in your vomit, you must repeat the dose and take them again. If you vomit more than 1 hour after taking your medicines and do not see the pills and capsules in your vomit, They have most likely been absorbed and do not need to be repeated. Finally, if you continue to vomit and are unable to hold down your medicines and miss at least 2 doses, you must page your transplant coordinator or the on-call liver transplant coordinator immediately. Diarrhea is another problem that can affect absorption of your immunosuppressants. Diarrhea is 4 to 5 watery bowel movements in a 24-hour period. If you have diarrhea, you must immediately page your transplant coordinator or the on-call liver transplant coordinator. Diarrhea can be a side effect of the medicines you take or can indicate that you have an active infection. We also measure immunosuppressant blood levels. Whenever you come to the lab or clinic to have your blood drawn, you must wait until after the blood is drawn to take your TACROLIMUS, cyclosporin, ZORTRESS, or EVEROLIMUS. We measure the trough levels, known as the valley level or the lowest level in a 12-hour period, of these medicines in your bloodstream. If you take these medicines prior to the blood draw, your blood level will not be accurate and you may be over or underdosed. It is a good rule not to take any medicines until your blood tests are drawn. The amount of PROGRAF, Neoral, Rapamune, or ZORTRESS you may take changes from week to week, and the dose that we prescribe for you is determined by how high or low your trough level is. Therefore, it is crucial that you wait until after the blood draw to take these medicines and that you take these at a consistent scheduled time. Furthermore, when we take immunosuppressant blood levels, you must always bring your immunosuppressant medications with you to the lab and clinic so that you can take your dose after your blood is drawn. If you accidentally take your PROGRAF, Neoral, SIROLIMUS, or ZORTRESS before your blood is drawn, do not proceed with the blood draw until speaking with your coordinator. You may request the lab page your coordinator. Other rules about taking the immunosuppressants revolve around missed doses. Missing even 1 dose of the immunosuppressant can trigger a rejection episode. If you miss a dose of any of your immunosuppressants, you must notify your outpatient transplant coordinator or the on-call coordinator. Your transplant coordinator may want you to have blood drawn to check the level of your immunosuppressant in your bloodstream and to be sure that your liver is working well. You should never double up on any of your immunosuppressants to make up for a missed dose. Doubling up on the doses can result in life-threatening side effects. Other rules revolve around late doses. If you take your immunosuppressant late, you should always at least leave 8 hours between your current dose and your next dose to minimize severe side effects. For example, if you normally take PROGRAF at 8 a.m. and 8 p.m., but today you forgot to take your morning dose until 1 p.m., you should wait until at least 9 p.m. to take the second dose of the day. Ideally, immunosuppressants should be taken 12 hours apart to maintain steady levels in your bloodstream. Another area following transplant are medicines used for prophylaxis. Medications prescribed for prophylaxis are for preventing certain infections or conditions from developing. After liver transplant, patients may be at risk for certain infections or conditions. These medicines are taken to help prevent these problems. Another area of prophylaxis includes medicines that prevent viral infections known as antiviral medicines. For 100 days after your liver transplant, you will be given an antiviral medicine. You will be discharged home on Valcite, also known as valganciclovir, and it will be taken once daily. This drug prevents infections resulting from CMV, also known as cytomegalovirus. It's a virus that most of us are exposed to by the time we are adults, but it does not usually cause active infection in people who are not immunosuppressed. These medications prevent infections from many viruses that cause fever blisters, cold sores, chickenpox, and shingles. Common side effects of Valcite include a low white blood count, low platelets, and anemia. Another type of prophylaxis is antifungal prophylaxis. You are at risk to have infections from fungus, also known as yeast infections. You will be given a medicine called diflucan, also known as fluconazole, for 42 days after your transplant to prevent fungal infections. Side effects of diflucan include raising the levels of your immunosuppressant medicines in your blood. When your fluconazole is discontinued, we will obtain blood tests and may increase your immunosuppressant dosing. This will require blood tests every 2 to 3 days for 2 to 3 weeks. Fungal infections can cause rashes, vaginal discharge, and a white coating on the tongue, inside the cheeks, or in the back of the throat. Fungus can also cause a thickening and discoloration of the nails. Serious fungal infections can cause lung, blood, or brain infections. If you've lived in the southwestern United States and have tested positive for valley fever, also known as cocci, you will need to take diflucan or fluconazole for life. Other issues around antifungals include their interactions. Due to most antifungal medicines having interactions that may raise or decrease your immunosuppressant drug levels, it's critical that you let your transplant coordinator know if any other doctors plan to prescribe this type of medicine before you start taking it. You will also be taking a medicine called Bactrim DS, also known as trimethoprim sulfamethoxazole double strength, to prevent pneumocystis infection in your lungs. You will take this for 1 year after the liver transplant. However, you may need to take Bactrim longer if you're treated for rejection. Bactrim DS prevents pneumonia caused by a protozoal infection. This organism normally does not make people sick if they're not immunosuppressed. 1 tablet is taken every day. Side effects of Bactrim include low white blood cells, low platelets, anemia, rash, nausea, and sensitivity to sunlight. Bactrim DS should be taken with a large glass of water and with food to prevent nausea and to aid in absorption. If you have an allergy to sulfa drugs, you will receive a different medicine to prevent pneumocystis, including agents like dapsone, mepron, known as atovaquone. Other medicines we give for prophylaxis include agents to prevent ulcer and stomach irritation. Because you're taking prednisone to prevent rejection, you're at risk for developing stomach ulcers or irritation known as gastritis. You will be taking one of the following medicines to protect your stomach from getting ulcers based on your insurance coverage. Agents such as Pepcid, Prilosec, Prevacid, Nexium, or Protonix have been given. When you are off of prednisone, your transplant physician may discontinue the anti-ulcer medications. Additional supplements are also given. Supplements are generally not covered by insurance, therefore, you may need to purchase these supplements from a grocery, vitamin, or drugstore. You should ensure that there are no other unusual ingredients added, such as herbs. You may always check with your coordinator if you're unsure. You should not take any additional medications aside from what is listed on your medication list until you check with your coordinator. Magnesium is another necessary supplement that we administer following liver transplant. Magnesium pills replace the magnesium lost in your urine as a result of taking PROGRAF or Neoral. If the magnesium levels in your blood drops too low, you are at risk for experiencing seizures or other nervous system problems like tremors or headache. The magnesium pills that you receive include magnesium protein complex, 133 milligram tablets, or magnesium oxide, 250 or 400 milligram tablets. The usual dose is 3 tablets 3 times a day with meals. Although the milligram amount is different, the amount of actual magnesium in magnesium protein complex versus magnesium oxide is about the same. High doses of magnesium may cause diarrhea. Multivitamins are other supplements that are sometimes required after liver transplant. Multivitamins are safe to take as long as you are not substituting vitamins for good nutrition through a well-balanced diet. You may buy multivitamins over the counter. We recommend that you don't take more than the 100% of the RDA. Do not take vitamins with extra added iron. Do not take extra separate vitamin supplements such as vitamin B, calcium, unless directed by your transplant team or your primary doctor. If your potassium level is too high, you will need to find a multivitamin that is low in potassium. Iron is an additional supplement following liver transplant that is sometimes administered. Your doctors may want you to take an iron supplement due to anemia. A low red blood cell count, known as anemia, is common for the first 1 to 2 months after your transplant because it takes time for your body to make up the blood cells you lost during the surgery. Poor kidney function and some of your medications can also contribute to anemia. You may also be asked to take vitamin C to improve the way your body absorbs the iron. Additionally, B vitamin, called folate, may also be added for managing anemia. Iron supplements can cause constipation, dark or black stools, as well as nausea and an upset stomach. Be sure to take a stool softener, which can be obtained over the counter. Calcium supplements are also given after liver transplant. They may be given to promote and maintain bone health. You are at risk for brittle bones, known as osteoporosis, and may need to take calcium pills. You may also need to take calcitonin salmon, Fosamax, and vitamin D with the calcium to help strengthen your bones. You will be sent to a doctor who specializes in bone health after your transplant. We also administer medicines for high potassium. Please see the information at the end of the list of your foods you should avoid or limit if your blood potassium level is too high. High potassium in your blood is a common side effect of your immunosuppressant medications and can be dangerous. High potassium levels can affect the way your heart beats, resulting in an arrhythmia, also known as an irregular heartbeat. You may need to take a daily prescription pill called Florinef, known as fludrocortisone, to lower your potassium. The side effects of Florinef may include salt retention, swelling, and high blood pressure. Some transplant recipients may need to take a medication called Kexlate on an as-needed basis for monitoring and measuring high potassium levels in the blood. This medication may come in a powder form that you will need to mix with liquid. Kexlate can cause stomach upset and diarrhea and can interact with your PROGRAF. You must review your potassium food list and adjust your diet so that you're not eating too many high potassium foods. Another important class of medications given after the transplant are pain medications. Your surgical pain should improve within 6 weeks after your transplant and then can be controlled with regular strength Tylenol, also known as acetaminophen. You should not exceed a total dose of 2,000 milligrams of Tylenol in a 24-hour period, and you should use regular strength tablets. As an example, you should receive 325 milligrams of Tylenol given every 4 hours or 6 tablets per day within one 24-hour period. You should be very careful as Tylenol can also be found in other over-the-counter medications such as cold medicines. You should always read the medication label for the list of medicines it may contain. If your pain is not controlled, you should contact your outpatient transplant coordinator so that the cause of your ongoing pain can be managed appropriately. When you go home from the hospital, you will be given pain pills to reduce the pain caused by the transplant surgery. You will not be given refills for pain medicines unless you are continuing to experience a large amount of pain and have been examined by one of the transplant team providers. There are a number of medicines you must avoid following your transplant, including medicines known as non-steroidal anti-inflammatory drugs at any time after the transplant, because these medicines can damage your kidneys. Please be careful, as other over-the-counter medications may contain non-steroidal anti-inflammatory drugs. You should always contact your transplant coordinator and do not start any non-steroidals even if another doctor wants to prescribe them to you. You may only take aspirin if told to do so by your transplant doctor. You should avoid all non-steroidals such as Motrin and Aleve following your liver transplant. Over-the-counter medicines. You should carefully read the labels of all the over-the-counter medications. Many medications are considered combinations of medications that can harm you. When you purchase over-the-counter medications, you should buy each medication in its plain form to treat the single symptom you are experiencing instead of medications that contain 2 to 3 active ingredients. For cough and flu medicines, if you have cough, cold, or flu symptoms that last longer than 3 days, you must notify your transplant coordinator immediately. You must avoid all medicines that have a D after the name. For example, Claritin D or Allegra D. Taking medicines with DM after the name is okay. For example, Robitussin DM. For those of you experiencing cough with congestion or tightness, you can take plain Robitussin or plain Mucinex. If you have no congestion, you can take Robitussin DM or Mucinex DM. You should not take Robitussin PE or Robitussin CF because these will increase your blood pressure. For those of you with allergy, sneezy, or runny nose, you may take plain chlortrimeton, plain Dimetapp, or plain Benadryl. Claritin, Allegra, or Zyrtec may also be taken, but may cause drowsiness. Zinc lozenges, vitamin C, echinacea, golden seal are also safe to use only in recommended dosages, but may or may not be effective. If you have nasal or sinus congestion, some decongestants can make high blood pressure worse, such as Sudafed. You should not use nasal sprays for longer than 3 days. You can take 6-hour Afrin nasal spray or 6-hour neosynephrine nasal spray or normal saline spray. You should avoid Sudafed or medicines containing phenylpropanolamine in any cold medicines or decongestants. Decongestants can cause or worsen blood pressure. If you have a sore throat, you can take chloroseptic lozenges or spray or nice lozenges, sugar-free for diabetics. If you have body aches and pains, you should take 2 regular strength, not extra strength, plain Tylenol, acetaminophen, with the same dosing recommendations as above. You should never take non-steroidal anti-inflammatory drugs, and you should call your coordinator if your pain persists. We prefer you always take your temperature with a glass thermometer. Otherwise, have more than one digital thermometer available in case some of the batteries die. Immediately notify your transplant coordinator or the on-call liver coordinator for any fever of 100.5 degrees Fahrenheit or higher. You may take 2 regular strength, not extra strength, plain Tylenol, also known as acetaminophen, every 6 hours as needed after you have reported your fever to your coordinator. As mentioned above, do not take any non-steroidal anti-inflammatory drugs such as Advil or aspirin, and do not exceed more than 2,000 milligrams of Tylenol in a 24-hour period. Please allow the Tylenol to wear off every 6 hours for no more than 24 hours and recheck your temperature with a thermometer. If your fever significantly worsens before then or continues without improvement, please call your coordinator. With respect to herbal remedies, they are not safe for you to take. Never take herbal remedies following your transplant. Now we'll discuss vaccines or immunization in liver transplant patients. You must check with your transplant coordinator or transplant doctor before receiving any vaccination following liver transplant. You must be sure that any vaccine you get contains only dead viruses. You are not permitted to have any vaccines that are made with live viruses. You may get an annual flu shot. Some transplant physicians will let you get the flu shot early, within 3 to 12 months after your transplant. Vaccination taking less than 1 year out from transplant may not be as effective. Tetanus booster, Pneumovax, and or hepatitis A and hepatitis B vaccines can be taken 12 months after the transplant. With respect to typhoid, only Typhorex vaccine is allowed. There are some vaccines as a transplant recipient you should avoid. You may not have the following vaccinations after your liver transplant: diphtheria, pertussis, or tetanus. No smallpox immunization, no yellow fever immunization, no MMR immunization, no polio or shingles immunizations. You may not receive any shingles vaccine after the transplant. Even though the currently available Shingrix vaccine is not a live vaccine, the Shingrix vaccine has not yet been determined to be safe or effective in transplant recipients. The flu mist must also be avoided as it's a live vaccination. People who have taken any live vaccines may shed the virus in their bodily fluids for up to 3 months. Therefore, transplant recipients should avoid contact with bodily fluids of vaccinated persons for up to 3 months. This includes infants and small children. If you come in contact with these fluids, such as baby diapers, please use gloves and carefully wash your hands afterwards. You may need to shower and change clothes depending on the amount of contact the fluids made with your clothes and skin. Because you are immunosuppressed, these viruses, although weakened, can still infect you.